Hello, Adventist retiree. Steve Thurmond here with Forward Financial. It's been a while since I've had any communication through email or video with you folks, so this has been a long time coming. It seems like every year, as the annual election period approaches, I end up chasing my tail and getting behind before I need to have everything in place for you folks. So this year is no different. As many of you are very aware, the last few years um, with my cancer diagnosis was certainly a challenge. This year, I have no real excuse except that our two daughters have started kindergarten and pre-kindergarten, and time seems to have sped up exponentially and is moving at an alarming pace. But if you folks have children, you know exactly what I'm talking about, I'm sure. So, nevertheless, I just want to reach out to you and remind you that the annual election period coming up, October 15 to December 7, is right around the corner. This is often misnomered open enrollment, and I only say that because open enrollment is actually a completely different window of time in which you can do different things. So, this window of time is called the annual election period. And if anybody ever calls it open enrollment, feel free to correct them. Open enrollment is a different window of time that is January 1 to March 31st of each year. And you can do different things during that window of time. But October 15 to December 7 is the annual election period, and this is specifically the time in which you can make changes to your prescription drug plan that you have through Alight Solutions. As all of you should be aware at this point, what used to be AON, is now Alight Solutions. Alight Solutions acquired Aon about a year and a half ago or so. Now it's been well over a year since it's now been Alight Solutions. But how what they provide to you, the service and what they do is exactly the same. They were just acquired by a different organization. So your health reimbursement account functions in the same way. The requirements of you to maintain one product through Alight Solutions at all time is exactly the same. The claims process from your spending account, each deposit that shows up in your checking account from your health reimbursement account shows up as YSA. That stands for your spending account. All of that is exactly the same. It has not changed whatsoever. So again, just to reiterate, October 15 to December 7 is the time of the year in which you can make changes to your prescription drug plan specifically through Alight Solutions. This window of time has no bearing whatsoever to your Medicare supplemental plan that you have directly through me. Whether you have Allstate or Cigna or Mutual of Omaha or United Healthcare or Anthem or Crum and Forster or Prosperity Life or GPM or any of the other many options available in the market that I may have enrolled you into in the past, those plans are supplemental plans and they have no bearing whatsoever on this annual election period window. You can change your supplemental plans at any time of the year for any reason as long as you are healthy and can pass underwriting guidelines. And in certain states, 14 states to be exact, you also have what's called a birthday rule or an anniversary rule or a rolling open enrollment time where you can switch your supplemental plan at any time or during those different birthday or anniversary rule windows, even if you're unhealthy. Now, there's 14 states specifically that have that provision, and most likely you know if you live in one of those states because you get correspondence to that effect, or I've mentioned this in the past. The big states are California, Oregon, Washington, Maine. Those are the four big states that have birthday rules. Oklahoma just picked up a birthday rule. Nevada has one. Idaho now has one. The trend is that more and more states are adding these birthday rules, which on one side is good because for those of you that are unhealthy, you can change your supplemental plan during those various specific birthday rule or anniversary rule enrollment windows. On the other hand, this now allows individuals that are sick to make changes during those times. Sicker individuals are higher risk to insure, and the only way to offset the risk for taking on unhealthier individuals is to raise rates. So generally speaking, the states that have birthday rules or anniversary rules or rolling open enrollment windows, you're going to pay a higher premium for your supplemental plan in those states. So again, I just wanted to touch on that briefly. Just to reiterate, the annual election period of October 15 to December 7 has no bearing whatsoever on your supplemental plan. It only pertains to your prescription drug plan that you have through Alight. And this is the time of the year where you want to be proactive with your drug plan through Alight to make sure that you're getting best value. Why? Because these drug plans, as you're well aware at this point, change literally every year in one or many aspects. The premiums change, the preferred pharmacies change, the mail order arm for these different carriers change, the deductibles change, the copays can go up and down, the tier structures can change. These things are literally in flux every year. It is a giant pain for all of us, me and you included. I spend the last 7, 8 weeks here in this last quarter just switching people from drug plan to drug plan to make sure you're getting best value. And that's fine. That comes with the territory. I expect it and do my best to prepare for it each year. But point is it's a pain for all of us, but we do our best. We put our heads down and we get through it each and every year. All of you should at this point have received your annual notice of changes booklet in the mail. This is the annual notice of changes booklet for my mother. She has the Aetna Silver Script Smart RX plan that many of you have. And the changes are minimal. The premium in Tennessee has gone up a little bit with this plan. The deductible is going up next year for everybody. I believe it's $545 next year for most plans in the market. Preferred pharmacies change a little bit year to year. Anyway, all of the changes to your specific drug plan will be in your annual notice of changes booklet. So it's very important that you read through that booklet and see if you're okay with those changes. If you are okay with the changes and you don't want to hassle with changing your drug plan to a different drug plan, do absolutely nothing and your current plan will automatically renew through Alight. So you're fully creditable and qualified in the eyes of CMS, the Center for Medicare and Medicaid Services, Alight Solutions, the broker that you have to work through for your drug plan, the North American Division of Avenists, which qualifies you for the health reimbursement account on an ongoing basis. So again, if you do nothing and you're okay with the changes that are happening to your plan, do nothing and it will automatically renew on its own. Just know that you agree to all of those changes that are happening to your plan if you do nothing and don't make a change. For those of you that want to make a change, that's what Alight is for. That's what I am here for. If you have the ability and you are comfortable with logging into your Alight account and reviewing your plan, drug plan specifically, options, and making a change yourself, please, by all means, do so. I am one person. I do my very, very best to help as many people as I can this last quarter of the year. But again, I'm just one person. I pull 12, 14-hour days. At least I have in the past. I'm trying to keep that a little bit lower this year just because of my health. I'm trying to be more mindful of my health. But if you have the ability to log into your Alight account, review your options for next year, and make a change yourself, please do so. If you are uncomfortable with doing so, that is what Alight Solutions is there for. Remember, they're also your broker for your specific drug plan, but that's also what I'm here for. So for me, it's first come, first serve. Most of you have a link to my calendar at this point where you can just hop on there and schedule at your convenience. And I will provide that again in the email that this video link was sent in. It's very simple. It's just myname.com. That is stevethurmond.com. stevethurmond.com. Just go to stevethurmond.com. It's my electronic business card. On that web page, that small splash page, you'll see all of my information. It's got my office address on there. It's got right at the very top, it says click here to schedule an appointment. And that goes directly to my calendar where you can schedule an appointment with me at your convenience. You can choose a phone consultation. You can choose a Zoom call where you'll see my face on the camera, or you can choose an in-house appointment. Keep in mind, this last quarter of the year, I'm absolutely buried, and in-office appointments take considerably longer in my experience than just doing it over the phone or doing a quick Zoom call. But I leave that option open to you if you'd like. Some of you still like to shake hands, and it is a treat for me. I don't get to see people in my office often, but you're welcome to come. And we sit here, we pull up all of your information on the screen back here, and we look at the plans and we'll make a move for you. So that's fine as well. Don't hesitate to set in office if that works best for you. But again, be mindful that in-office appointments take considerably longer in my experience. And I'm trying to be as efficient as I can for as many people as possible this last quarter of the year. Most of you at this point have gotten this letter from Alight. Again, this is my mother's. And some of you seemed a bit alarmed by it. And all they're doing is just reminding you that you must maintain your drug plan through them at all times. And that's really all it is. They're also scheduling an appointment for you. If you want Alight to help you choose a different drug plan for next year, or just review your options for next year, by all means, keep that appointment. Confirm that appointment, log into your Alight account, and confirm that appointment with them, and they will call you at that time that they have sent you in your letter. If you do not confirm that appointment, they won't call you. They're not going to call you, at least to my knowledge. So you do have to actually confirm that appointment if you want them to call you. So if you don't confirm it, they're not going to call you. And then you are left to either reach back out to them, be proactive and reach out to them, or be proactive and reach out to me, or be proactive and do it yourself by logging into your account and looking at your options and making a choice, which you certainly can do. I know some of you are comfortable with doing that. I know the majority of you are not, because I have given you fish for years rather than teaching you how to fish. And that's fine. That's no problem. I don't mind doing it. I am doing Alight's job for them in that regard. And so, but it's a service I provide to your retirees. We have to work through the Alight platform for your drug plan in order for you to maintain the health reimbursement account and be qualified to get that subsidy from the North American division on an ongoing basis. And again, just like I've done the last 6 years, 7 years now in the past, I am here to help and help you navigate your drug plan options. But it is first come, first served, and I will probably be pulling 10-hour days here. I'm going to try to keep it under 12 just for my health. And that's all I have to say about that. So feel free to reach back out to me. Reach out to me, hop on my calendar. If you'll look in this email that was sent you at the very bottom of the email, right under my signature and my logo, at the very bottom, it says click here to schedule an appointment. Click on that button. It should go right to my electronic business card where it says click here to schedule an appointment, and that goes to my calendar. But you should be able to find your way to my calendar fairly easily just by going to stevethurmond.com or clicking that button in the email below. So yes, annual election period, October 15 to December 7. Important to be proactive with your drug plan if you want to make sure that you're getting best value. A lot of you have this same Aetna SilverScript Smart RX drug plan, and you may recall last year that plan was not available to new enrollees last year simply because Aetna no longer pays a commission on that drug plan. And guess what? If Alight isn't getting their piddly $2 a month in commission for that drug plan, they're not going to offer it to you as an option. Those of you that had the plan from a previous year, back when it was called Aetna SilverScript Smart RX, as you recall, the names changed almost every year as well. You're grandfathered in, and that plan is still tied to Alight, and they are still getting a commission on that old plan. It's just that as of last year, new enrollees don't have the option of choosing that plan because as of last year, that plan no longer pays a commission to brokerages like myself and like Alight Solutions. And since they don't get a commission on it anymore, they don't offer it to you guys as an option. Again, further highlighting the subpar experience, shall I say, that you have with Alight Solutions. But no harm, no foul. I'm not going to get on that soapbox. If you've dealt with Alight Solutions or back when it was Aon long enough, you know exactly what I'm talking about. So no harm, no foul. We play their game. We jump through their hoops. We get your subsidy on an ongoing basis, and we move forward. Some of you in this last year, I've noticed, have gotten some overpayment notices from Alight. I may have switched supplemental plans for you through the years, and they may still be reimbursing you on an old supplemental plan that you either had through them or one of the old supplemental plans that I put you on originally, and we've made a move since then. And it's technically an illegitimate claim if they're paying you on an old plan that you no longer have. It's an easy fix and an easy solution. So if you've ever gotten one of those overpayment notices where they're asking you to pay back the subsidy, it's a simple process. Yes, you do have to pay it back, but it goes right back into your health reimbursement account. And then we just refile a legitimate claim to get it back out. So it's not like you're losing money or you're paying them anything that's not due you. It's just we have to square up the claim and make it legitimate for tax purposes. Because technically, any overpayments from a health reimbursement account can have tax implications at the end of the year. So we want to square that up, make sure that is balanced correctly, and then we just file a new claim and it comes right back to you under a legitimate claim. So don't hesitate to reach out to me if you've gotten any kind of email or correspondence or a phone call saying that well, I'd be careful of the phone calls. Generally speaking, those phone calls are scams. So it would come in the form of an email from Alight Solutions or a notice in the mail with their letterhead on it. You have to be very, very careful nowadays with the amount of scams going around. They're ridiculous. They're an absolute nuisance between the telemarketers and the spam phone calls and the robocalls and the bait and switch and the clickbait and the phishing emails. It's landmines wherever you go nowadays, and you have to be very careful. So if you're unsure, reach out to me and I'll take a look at the email or hear about your situation, and I'm happy to give you some advice because I've seen most everything at this point. So again, just to reiterate there, if you've gotten an overpayment notice that's asking you to pay it back, reach out to me and I'll walk you through that process. At this point, I've talked to a lot of you about the dental, vision, and hearing coverage that you have from Sharp. Remember the Sharp dental, vision, and hearing coverage that you were offered when you initially retired, or for those of you that have been with me for a while, that you had back when Sharp also covered the medical and hospital side of things. Those of you that have that coverage, it's great coverage. I've never disparaged the Sharp dental, vision, and hearing coverage, but in my opinion, it's not a very good value because of what the true cost is. I'm finding that a lot of you Avonus retiree clients do not realize that the true cost of your dental, vision, and hearing coverage is $105 per month per person. As a couple, that's $210 a month you are paying for the dental, vision, and hearing coverage. Again, it's good coverage, and it should be because what you're paying for it. But in my opinion, there are better value propositions available in the market. And some of you I've talked to with this about this at length. Some of you have made some changes in that regard. Um, but the bottom line is, for most of you individuals, as a couple, I can offer you a comparable option that actually has better dental coverage, equal vision coverage, but slightly less on the hearing aid coverage. And that's the factor there. So if you've got really expensive hearing aids and you like that robust coverage that you get from Sharp on the hearing aids front, because you do get $2,200 a year towards hearing aids with Sharp, which is good. That's really good. Then you may want to stick with what you have. If you're okay with taking a little bit of a haircut on the hearing coverage, I can offer you a solution that will cut your cost in about half. So rather than $210 a month, I can cut that down to about $102, $103 a month as a couple, which will give you dental, vision, and hearing coverage. It's just less on the hearing coverage. So if you don't have hearing aids, or you don't need hearing aids, or it's not a present need, then you may want to get in touch with me and I can explain how you can leave the Sharp dental, vision, and hearing coverage and put essentially an extra $100+ per month in your pocket while still having dental and vision coverage from a different provider outside of the Sharp solution. So now the one caveat there is, if you leave the Sharp dental, vision, and hearing coverage, you can never get it back. You can't go back on that coverage once you leave it. So again, it's good coverage. I just don't think it's a very good value because of the price point that they are charging you for it. I'm finding a lot of you retirees don't realize that they're withholding money from your health reimbursement subsidy amount, and they're also deducting money from your retirement check each month to offset the cost of that Sharp dental, vision, and hearing coverage if you elect into it. For example, if you are a fully vested retiree with 35+ years of service, you actually qualify for $2,400 a year. That's correct, $2,400 a year in subsidy. If you opt into the Sharp dental, vision, and hearing coverage, they withhold, Sharp, Adventist Risk Management, withholds $780 from that $2,400 a year in subsidy, leaving you with $1,620 that actually gets deposited into your health reimbursement account that you can file claims from. In addition to withholding that $780 a year in subsidy that's due you, they also withhold $40 per month per individual from your retirement check. So if you're a couple, you're looking at 780 times 2 and 40 times 2. If you do the math on all of that, it works out to, on a monthly basis, $210 per month as a couple. Now, in my opinion, they haven't been very transparent about that in the past. New retirees that are going through this process, it very clearly says on there, the dental, vision, and hearing coverage is $105 per person. If you have less than 35 years of service, you get less subsidy, but the cost for the dental, vision, and hearing coverage is still the same, $105 per person, $210 as a couple, from your subsidy and as a deduction from your retirement check each and every month. So again, it's good coverage, but it ought to be because it comes with a Cadillac price tag. And in my opinion, there are better value propositions in the market. So if you would like me to explore that with you, I'll explain it in detail, and we can look at the various options available to you in your specific market. And if you want to take advantage of that savings, by all means, I can help you do so. So don't hesitate to reach out if you've got questions there. If you do decide to leave the Sharp dental, vision, and hearing coverage and go with the solution that I can provide you, you will need to do so before year's end. And I would recommend sometime in late November, early December, reaching out to Adventist Risk Management and saying, I no longer want the Sharp dental, vision, and hearing coverage. I found another better price solution elsewhere. You will get your extra subsidy. So for those of you that are fully vested, rather than getting $1,620 a year, deposited into your health reimbursement account. You'll get $2,400 a year each deposited into your health reimbursement account. And then they will also no longer take that $80 as a couple or $40 as an individual out of the retirement check each and every month. So again, all you need to remember is that we don't want you to go without dental, vision, and hearing coverage, but the solution that I can provide you when it all comes out in the wash can save you $100+ per month, and still have dental, vision, and hearing coverage that is actually better on the dental, equal on the vision, but less on hearing aids at the end of the day. That's what it comes down to. And if you don't need vision or hearing aids and you just need a standalone dental plan, the savings is even more pronounced. You could save even more money. But again, that all depends on what your wants and needs are. So I'm just putting that out there to you. Um, don't hesitate to reach out. Anything insurance, retirement planning related, if I don't do it and can't help you directly, I can usually point you in the right direction. So make me your first call. Send this video to other Adventist retirees that may be in the Alight scenario and in the subsidy scenario. If I can help them, your referrals to me are the best compliment to me and certainly helps me in my business. So, and thank you very, very much for those of you that have referred many clients to me through the years. Very, very much appreciated. You folks are all very, very much appreciated. Some of you, many of you, actually, most of you have been with me since the end of 2016, starting 2017. So we're coming up on our seventh year here together as a client broker relationship. And I very much appreciate all of you. Thank you for the words of encouragement through these last couple of years while dealing with my cancer diagnosis and treatment. I've got to say things are going really well in that department for me. No evidence of disease, and that's about all I can hope for. I do get routine scopes every 6 months where they go take a camera up my nose and down my throat and they look at everything. Haven't had to do any imaging since my surgery, which I had in early 2021. So finished treatment late, was it 2021 or 2022? I'm losing track now. Anyway, my 2 year mark coming up April of next year, 2024, is the 2 year mark from my last radiation treatment. And at that point, I would be considered in remission. So I eagerly await that date to approach. I'm controlling what I can, diet, lifestyle, tried out quite a few different diet scenarios, which have been polar opposite, vegan to carnivore and somewhere in between. So it depends on which data you read and which guru you want to follow. There's so much information out there. But anyway, I feel good. I'm exercising regularly. And most importantly, I'm eating clean. And that is whole foods. I've eliminated sugar and processed foods from my diet for nearly 2 years now. And I think that's my best defense against a recurrence of cancer. But yes, I'll stop rambling now. Point is, hop on my calendar if you want guidance for your drug plans for the 2024 calendar year. If you don't want to change your drug plan, do nothing and it will automatically renew through Alight, and you will still be fully creditable and qualified in the eyes of the church, CMS, and Alight Solutions. So, but yes, reach out at any time. Most of you should have my personal phone number. Just a quick mention, if you have the 800 number for me, if you're one of my clients and you have my 800 number, please replace it with my personal number. My personal number is 615-438-8359. Again, that's 615-438-8359. If you are my client, I have your name and phone number programmed in my phone. And that's why when you call my personal number, I answer and I say your name immediately because I know that you're calling. If you call the 800 number, I use that number only for marketing purposes, and I have no idea who's calling that number. And there's also a slight delay there on that 800 number because the 800 number just forwards to my cell phone. So I would prefer it if you call my personal number. And if you want to text me, you're not going to get anywhere by texting the 800 number. Please text my personal number, and I answer texts, emails, and phone calls and voicemails all throughout the day. So just a point there.